No, not all of them are cancerous. Quite a few of them are. So when we think about spinal tumors, we are talking about the nature of them. So some are benign, some are clearly malignant, and there are some that are in between, meaning they have a potential to transform. So no, not all of them are cancerous. Spinal tumors themselves very rarely are the direct cause of death, but they very commonly cause disability and morbidity, and unfortunately quite a lot of disability. And then I think what most people would be familiar with is the paralysis that they cause. So that is a very big disability. People are unable to walk around. And when you lose that ability to walk around, that is a precursor to several other complications that can set in over time. But very uncommon for somebody to die directly as a result of the spinal tumor. There are a number of different tumors, and they all would have different causes. So one of the commonest things that I deal with would be secondary spinal tumors. So these are secondary deposits in the spine from a primary cancer elsewhere, for example, lung cancer or breast cancer or colon cancer. And that would by far be the commonest kind of tumor that I see. In fact, unfortunately, even in this day and age, a very high number of patients present with spinal tumors as their first presentation of cancer, meaning they did not have cancer before, but this is when they kind of come to find out that they have cancer. Very small number of spinal tumors may be familial, and they usually tend to be more on the benign end. But by and large, it's very difficult to say why an individual has developed a cancer or a spinal tumor indeed. They can be painful. So if a spinal tumor has caused damage to the surrounding bone, that can cause pain. If a spinal tumor is pressing on a nerve, that can be very painful. So yes, they can be, but equally, they may be relatively silent in terms of symptoms. So first question one has to answer is, do we think we're dealing with a benign tumor, or do we think we're dealing with a malignant tumor? By and large, all surgery would be done under general anesthetic, but the extent of surgery and the aim of surgery would be different depending on the kind of tumor we're dealing with. So most of these cases, they will, in the UK, be dealt with by an MDT, which is a multidisciplinary team, where you will have a specialist spinal surgeon who specializes in management of spinal tumors. You will have a neuro-oncologist such as myself. You'll have a neuropathologist, a neuroradiologist, and we would sit down and discuss the optimal approach for each tumor.